Hi everyone. I get requests from time to time on how indirect bonding works regarding the lab procedure all the way through to the bonding protocol chair side. So I asked one of our clinical advisors, Dr. Graham Jones, if he would be so kind as to record some video for us in his office with his team on his process and what works for him. He indirect bonds all of his cases. So what you'll see here in this video is the lab technique that he goes through from the stone model all the way through preparation up until bonding. So I hope you enjoy the video, and if you have any questions, please let me know. Thanks.
To start your indirect bond setup, start with a set of models made out of plaster or 3D printed. The model should be high quality and free of bubbles, voids, or holes. They should also be allowed to set until they're completely dry, and this usually takes up to 24 hours. Before you start your setup, remove any bubbles or other defects on the model that would prevent the model from being a perfect replication of the patient's mouth. After the models have been allowed to completely dry, you can place any markings on the model that you'd like to help guide your bracket placement. Before you place the brackets on the models, paint a thin layer of liquid separating medium wherever the tray will be placed. Here we're using foil coat from Whip Mix, but you can use modern foil or any other liquid foil substitute that's water soluble. Paint the foil liquid in a thin, even layer on all of the teeth and the tissues around the teeth where the tray will be fabricated. After you've painted the foil liquid on, allow it to dry completely. Drying takes at least half an hour and perhaps longer. Once the separating liquid or foil substitute has dried completely, you're ready to put the brackets on the indirect bond model. Start by placing your adhesive, like brace paste, on each bracket individually, making sure to press the adhesive into the mesh on the back of the bracket. Then apply the bracket directly to the indirect bond model. Once all the brackets have been placed on the model can be placed inside of a light-free box or in a dark place so that no light will start to cure the adhesive on the brackets. Now whoever will be in charge of final bracket positioning can take the model out of the box, firmly press each individual bracket into the model to express any additional adhesive, and then clean this extra adhesive flash off from the model. Do this for each bracket and then put them in their final position. At this point, the brackets can be cured so that the adhesive sets. At this point, the bracket should be placed in their finalized position and can be cured. You can cure with either a high-power curing light or the model can be placed in a curing machine. Once the brackets have been thoroughly cured in place, we can start tray fabrication. Block out the area gingival to the teeth with rope wax to act as your border for your tray as you're making it. Extend this block out wax about 2 to 3 millimeters gingival to the gingival margin. There's a variety of materials that you can make your indirect bond tray from. In this video, we're going to be using Luma, which is a transparent PVS material designed for indirect bonding. Make sure to place the material over the hooks and the bracket slots so that the next material that will make the outer portion of the tray doesn't get stuck in the bracket slots. Any PVS, especially clear material, can be used for this step. Next, we'll be making our outer portion of the tray using a hard bite registration material. It's a clear PVS material called Fresh Bold Clear Bite, but there's a number of other products that can be used to make this. This will be 2 to 3 millimeters thick and extend over all surfaces of the brackets and the occlusal portion of the teeth and extend down to the lingual. It's kept in place by that wax matrix that we made in the previous step. In order to form it properly, we've cut out some templates that we use that are made out of a clear plastic material, like a transparency material that can be used to form the tray in a horseshoe shape. This top portion is used to make sure the tray remains flat, but we don't press so hard that we press the material all the way against the teeth. We're still leaving it about 1.5 millimeters to 2 millimeters thick. Let this set completely before we're going to the next step. After the indirect bond tray material has set fully, then you can begin to trim it to the right size and shape. Once it's been trimmed, place it in a bowl of warm water for at least 20 minutes to allow the separating liquid that was painted on in the previous step to dissolve completely. When the separating liquid is dissolved, the brackets can be removed with the tray from the model without the adhesive on the bracket sticking to the model anymore. Leave the tray about 2 millimeters thick at all points. At this point, it can be placed in the warm water to dissolve the separating medium. Once the models and the roughly trimmed trays have been soaking in warm water for at least 20 minutes, the separating medium should have dissolved. At this point, you can remove the models and the trays from the water and start to gently peel the tray off the model. The tray should be removed easily and the brackets should remain in the tray. There will be adhesive on the back of the brackets, but none remaining on the model. At this point, remove any extra tray material or wax that might be there, and you can place the trays with the brackets facing the curing light in a curing oven, or you can use your curing light to re-cure any uncured resin that may remain on the brackets. When the bonding trays have been removed from the models, from the water that it was soaked in, lightly dry things off before placing in the curing oven. At this point, the brackets in the indirect bond tray can be cured individually by hand with a curing light, or can be placed in a curing unit. When the brackets have finished curing, take them out of the curing unit. The trays will be ready to process. Now it's time to prepare the adhesive base on the back of each bracket. First, lightly micro etch for 1 or 2 seconds the adhesive on the base of each bracket to remove any residual stone or separating medium that could be on the adhesive. After the micro-etching step, rinse and gently brush the inside and outside of the indirect bond tray to remove any residual aluminum oxide. Be careful not to brush so hard that you would displace any of the brackets or remove any of the adhesive from the back of the bracket bases. After rinsing, thoroughly dry the inside and outside of the tray to remove any water that could be left over. Allow the tray to set and dry to make sure any water left over has evaporated. After the brackets and tray have thoroughly dried, add a thin layer of bonding resin to the adhesive on the back of each bracket base. Here we're using a Sure bonding resin, but other products like Ortho Solo can be used as well. Paint the back of each bracket and then allow that to air dry.
All right, so that was a video from Dr. Graham Jones on his lab techniques for indirect bonding. If you guys have any questions on anything that you saw in the video, please feel free to ask. Keep in mind that was Dr. Graham Jones' procedure and what works for him in his office. There are certainly other techniques, other products to use, but that just sheds some light on what works well for him. All right, thanks guys.